Assalamu alaikum. The clinical day. First scenario, Mr. John Smith, 35 years, came with complaint of diarrhea. His vitals are normal. Please examine him and address his concerns. Ready? Let's start.
Yes, I'm ready.
Here you go.
Hello.
Yes,
Hello. Hi. I am Dr. Sadiq. I'm one of the doctors working today. May I confirm that you are Mr. John, 35 years old?
yes.
Yes. Hi, Mr. John. So today I would like to discuss with you about your health condition. I'm happy to examine you and answer all your questions and concerns by the end of this consultation. How this sounds to you?
It's quite fine.
Okay. So, Mr. Harrison, sorry, Mr. John, can you please tell me what brought you here today?
I am having loose motion since 1 year.
Okay. For the last 1 year.
Yes, yes.
Okay. Was it started gradually or suddenly?
Gradually,
Mm-hmm. Can you explain more? How many times you open your bowels?
uh, 3, 4 times daily I'm opening.
Mm-hmm. Okay. From the start, or is it
Yes.
increasing?
It's day by day. It's increasing.
Mm-hmm, mm-hmm, mm-hmm. I'm really sorry for that. So, Mr. John, do you have any tummy aches?
Yes, sometimes I'm having. Sometimes
Mm-hmm. Where is the pain?
in whole of my tummy, but
All
it's
of.
not so severe.
Mm-hmm, mm-hmm. So, if I ask you to give a score for your pain, from zero being no pain and 10 being the worst pain ever, how you score this pain?
1/10.
Okay. And is it all the time or just when you are about to open your bowels?
No, there's no time. Sometimes
Mm-hmm.
in one day I'm having a little bit pain. In 1 month, it's not
Mm-hmm.
very specific.
Mm-hmm. And did you notice anything makes it better or worse?
I did not notice anything.
I'm really sorry for that, Mr. John. What about the motion? Is it watery or
It is semi-solid.
semi-solid? Any blood in it?
No,
Any slime in it?
no.
Do you feel like it floats in the toilet?
Yes, yes,
Is it difficult to flush?
yes.
Oh, okay. Okay. And after you go to the toilet, do you feel like you still have some to pass and you need to go
No,
back again?
no, 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 no,
Mm, okay. And is it awaking you from sleep?
no.
Never. Okay. Okay. Mr. John, you mentioned you have tummy ache. Do you have any other like associated symptoms with this loose motions?
Like what?
I mean, like, do you have high body temperature?
No, no,
No. Do you have night sweats?
no.
Okay. Um, and have you? Does anyone told you that you look more pale than usual?
Yes.
Yes, you look pale. For how long?
From last 3, 4 months.
Okay, okay. And have you lost any weight?
Yes, I have lost weight.
How much over how long?
From the last 1 year, I lost 6 kg.
Mm-hmm. Wasn't intentional.
Yes, it's not intentional.
Mm-hmm. Okay. And do you feel any lumps or bumps anywhere in your body?
Yes, I have.
Mm-hmm. Can you please tell me what do you mean by yes?
I have lumps and bumps in my neck.
Uh-huh. Uh-huh. Okay. When it started?
It started 8 months ago.
8 months ago. And how many bumps you have?
Round about right side 4 to 6, left side also 4 to 6.
Mm-hmm, mm-hmm. And is it increasing in size or in number?
No, same.
Mm. Is it painful?
No, it's not painful.
Mm-hmm, mm-hmm. Did you notice any lumps anywhere in your body, in your upper legs or under your arms?
No.
No. Okay. Okay. And do you feel more tired more than usual?
Yes, because of this loose motion, I'm losing weight. I'm
Mm-hmm.
feeling more tiredness.
I'm really sorry for that, Mr. John. So how do you compensate for that?
I'm, there's no specific thing for compensation. I'm
Mm-hmm.
taking routine diet.
Routine diet. Okay. So did you notice any changes like for in your diet recently, like, or is
What?
it the same for the last 1 year?
Excuse me, what? I couldn't understand.
Uh, did you had any changes in your diet over this last year, or is
No,
it the
no.
same?
Diet, my diet is same.
Uh-huh. Okay. 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 So, Mr. John, are you known to have any medical condition?
Mm, yes.
Mm-hmm.
Yes, I have chest pain.
Mm-hmm. You have chest pain.
Yes, and my doctor told me that you have a cardiac problem.
Okay. Are you aware of this cardiac problem?
Yes, yes, my doctor told me that somewhat like pericarditis.
Mm-hmm. Mm-hmm. Okay. Are you taking any medication for that?
No, in the beginning, doctor gave me some medicine, but I did not take it for a long time. I just took for a few days, my symptom relieved, and I stopped the medicine.
And when was that?
It was around about 7 months ago.
Mm-hmm. Mm-hmm. Okay. And are you on regular follow-up?
No, no, I don't
No.
have any follow.
Okay. Okay. Any other conditions other than the heart problem?
Yes, I have pain in my joints, especially in my knee joints.
Mm-hmm. Mm-hmm. Mm-hmm.
In
Uh,
both knee joints, I have pain.
both knees. Are you taking any medication for that?
Only paracetamol I'm taking.
Okay. Did you seek any medical advice for your knees?
Yeah, no, I'm just taking paracetamol.
Okay. For how long you have pain in your knees?
It is also last 7 months.
Okay. Okay. Any swelling or any deformity or swelling in your knees now?
No, no, no,
No. No. Okay. Okay. Any other medical condition, Mr. John?
no, no, I don't have.
No. Okay. Can you provide your medication list?
I'm only taking paracetamol, and for loose motion, sometimes I'm taking lopramide, but it is not helping me.
Mm-hmm. Mm-hmm. Is bromide prescribed by any doctor?
No, I took it from the pharmacy.
By yourself. Okay. And do you feel it is helping?
A little bit was when I took it, it only give me a temporary relief.
Mm-hmm. 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 Okay. 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 Mr. John, is there any medical condition in the family?
No,
Mm-hmm. Okay. Have you traveled recently anywhere, Mr. John?
no,
No. Okay. And um, have you ever had chronic cough, like long cough for long time?
no, no,
Have you ever been in contact with someone who is coughing?
no, no.
Okay. Okay. Or having any chest condition? No.
Chest condition.
I
Yes,
mean,
I told
like.
I have chest pain 7 months before. I
Mm-hmm.
took medicine for a time being. After then, I'm okay.
Mm-hmm. Mm-hmm. Okay. 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 So, Mr. John, what do you do for living?
I'm a teacher.
You are a teacher. And do you feel like your symptoms affects your job or your daily life?
Yes, yes, really,
Mm-hmm.
because I have to go to the washroom again and again. From the
Mm-hmm.
last 1 year, I'm suffering this.
No, okay. Smoking, alcohol?
Yes, 5 cigarettes per day.
Mm-hmm. Mm-hmm. Okay, so smoking is not good for your condition, Mr. John. I highly advise you to consider stopping smoking, and I can help you with that if you are willing. Is that okay?
Very nice.
No. Okay. Mr. John, I would like to ask you some private questions. I'm sorry for that. It's just part of my assessment. Are you sexually active?
Yes,
Do you have a stable partner?
yes, I have stable partner.
Hmm. Sorry for asking. Any casual relations?
No, I don't have.
No. Okay. Okay. Mr. John, uh, okay. Uh, I would like to examine you if you don't mind, and while examining you, I might ask you some few questions. Is that okay?
It's okay.
Okay. So I will start by the hands and nails, palms and nails. Any changes?
No,
No.
no
Uh,
change.
sorry, pulse. I saw. Okay. So pulse, is it regular? You mentioned vitals is
Yes,
stable. Yes.
vital stable.
Blood pressure is fine.
Uh,
So I will examine the eyes. Any pallor or
yes,
redness or any? Mm-hmm.
yes, Bella.
Bell. Okay. Mr. John, have you ever had any like red eyes or sore eyes in the previous few months or after the start of this condition?
No, no.
No. Okay. I will check on the mouse. Any angular stomatitis, mouse changes, tongue changes?
Yes, I have on the periphery on my mouth. I have some sores, some
Mm,
cracking lines.
mm-hmm. Okay. When those started, Mr. John?
5 to 6 months before.
Mm-hmm. 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 Was it the same or started like worse before that? Was it the same since it started?
It is increasing.
Increasing. Okay. 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 So I will examine the neck. I will examine the lumps. The lumps, is it lymph nodes?
Yes, yes, lymph nodes.
Okay. Discrete or matted to it like attached together?
Discrete.
Discrete. Okay. Any tenderness in there? Any skin changes over them?
No, no, no.
All the same size.
Same size.
Okay. Thyroid?
No problem.
No problem. Okay. So I would like to examine the tummy, the abdomen. So superficial palpation.
Soft,
Mm-hmm.
non-tender, nothing
Mm-hmm.
else. No,
No
no,
organs.
no organomegaly.
Okay, and the right iliac fossa, any pain?
No, no.
No, no mass in there. Okay. Mr. John, how is your water works?
Waterworks is normal.
Normal. Okay. And you mentioned joints pain. Can I see your knee joints?
Yes, you can see.
Mm-hmm. Any changes? Swollen?
Yes,
Like
it is a
look,
little.
feel, and
Uh,
move. Uh-huh.
yes, yes, it is swollen, red,
Mm-hmm. Mm. Both knees?
both knees.
Okay. And what about movement? Is it painful?
Yes, on movement, on passive movement, I am feeling some stiffness,
Mm-hmm.
and
Mm-hmm.
on active movement, also a little bit pain while on active motion.
Okay. Is it hot?
A little bit.
Little hot. Okay. And you mentioned this is for like 7 months now, Mr. John?
Yeah. Yes, yes, yes.
Is it
With
this?
paracetamol,
Mm-hmm.
I got a little bit relief with paracetamol.
With paracetamol, little relief. Okay. Okay. And you don't, do you feel like high body temperature or sweating?
No, no,
Mm-hmm. Mm-hmm. Okay, Mr. John. Have you ever had skin rash or skin changes?
no.
No. Okay. So I will examine for the heart. What is the time? How? What is the time? When is this 2 minutes? Please tell me.
Yeah, no. It's started from zero again, and you passed 5 minutes. So you have still 3 minutes or 2 minutes now.
2 minutes now. Okay, so I
Yeah,
just
so your end time is 10, not 15, because 5 minutes was
okay,
skipped.
okay, and you can okay. So I will just quickly listen to the heart by the stethoscope, like epics and the
Yeah, yes,
four
I have mitral stenosis. I have murmur of mitral stenosis.
mitral stenosis.
Murmur.
Okay. 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 So,
And
Mr. John. Mm-hmm.
I'm when I'm moving my eyes, I'm feeling double also.
Mr. John. Good morning.
Yes.
2 minutes left.
Are you seeing double? Seriously, are you
And
seeing
yes,
double?
yes, I'm seeing double. When I'm walking, I'm my balance is not normal. My balance
Okay.
is not stable.
And
I
when that
cannot
is
maintain my balance.
okay. Really sorry for that, Mr. John. When it started?
Yes, it is from 7 to 8 months.
Okay. 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 So, Mr. John, what is your concern?
What is I'm having? Why I'm having loose motion from last 1 year?
Okay. Okay. So, Mr. John, is there anything in particular you are worried about?
Yes, why I'm having double vision? Why am I having balance problem?
Mm-hmm, mm-hmm, mm-hmm. So, Mr. John, from what we have discussed and from the examination, I have few options in my mind. So, I need to examine. Sorry, I need to run some investigations and images to find out what exactly going on with you. For the balance problem and for the balance problem and tiredness, it might be the some like because you are losing a lot of minerals and salts with the stool with the loose motion. So we need to check for all those things, and I'm happy to sit with you and tell you about the reports or the results of your investigations. I would like to do jelly scan to your abdomen, to your tummy as well.
Okay,
Okay.
doctor,
And we
why I'm
might
having
we
loose motion?
might take, yeah, sorry, Mr. John, but we might take one of the lumps in on you or a sample from the lumps in your neck to for investigations. Is that
Oh,
okay?
okay, it's okay.
Mhm.
Okay,
Mhm.
time is up, Mr. John. Thank you. The examiner question.
Okay, can you present your case?
So I reviewed this 35 years old gentleman who came complaining of diarrhea for the last 1 year. Um, it's getting worse. It's associated with on and off abdominal pain on a background of pericarditis and joints uh, swelling. And he also got lymphadenopathy and a mitral stenosis murmur in his heart
And weight loss also.
and weight loss, yeah, significant weight loss.
So what could be the differentials?
So I'm thinking of tuberculosis um, as a
But
as
my
a
lymph nodes, they are not mated
matter.
together. They are
Yes, it is.
discrete.
Yeah, it
I
is
don't
this.
have any contact with the sick person. Okay.
Yes.
Then what?
Ye-
Then what else?
what else? It might be inflammatory bowel disease, giving
Very
his
good.
diarrhea and the joints pain and swelling.
Okay. But
Uh,
how? But can you explain my cardiac problem, my neurological problem? This IBD can explain.
um, it might be explained by electrolytes imbalance.
Okay. What else? What else differential you want to put?
I will put hypomagnesemia as well.
Electrolyte imbalance. What else?
What else other than electrolyte imbalance?
Diarrhea 1 year,
Mm-hmm.
cardiac problem,
H
neurological problem, weight loss, lymph nodes, anemia,
mm,
any infection you can put any
HIV, HIV, HIV.
HIV.
Yes.
Okay. Any other infection?
Um,
Because I have
lip. Mm-hmm.
HIV, I don't have any correlation. I don't have any blood transfusion, no
Mm,
needle sharing, no tattooing.
yeah. Maybe leptospirosis.
Which
Leptospirosis. Maybe I can't remember.
leptospirosis, there will be kidney problem, jaundice, hepatitis, and
Yeah, yeah,
hepatorenal
yeah. They came
syndrome.
with hepatitis. Yeah, yeah, yeah.
And the
Yes.
workers, and he is working in some with sweeper and water
Yes.
sewage
Yes,
system.
yeah,
He
yeah.
will work.
Yes, you are
Okay,
right.
what else? Okay, how
Mm.
you will investigate?
So, I would like to run a, routine investigation starting from full blood count, um, full blood count,
Give me one
liver
diagnostic
function
test.
test, diagnostic
Give me
test,
one diagnostic test. Diagnostic. Only one
diagnostic,
diagnostic test. One
one
diagnostic
diagnostic
test.
test. I would like to do lymph node biopsy.
Okay, then what else?
Yeah, abdominal ultrasound
Okay,
and
diagnostic
echocardiography
test.
as well. Hmm?
I'm asking diagnostic test of diarrhea.
Of diarrhea. I would like to do stool analysis as well. Um,
Diagnostic test.
and endoscopy,
Very good. Okay, jejunal biopsy. Very
jejunal
good.
biopsy. Yes, endoscopy
Okay,
is jejunal biopsy.
okay.
Um,
Then what in the biopsy did you see anything? Any macrophages?
if there was microphages.
Any periodic acid shift maybe? Eh?
Mm-hmm.
And then how you will manage?
How I will manage? So I will start with supportive management. If any electrolyte imbalance, I will correct it, and I would like to include a team of specialists in the management of this case, including the gastroenterology team and specialized nurse social worker and uh, the cardiology team and neurology team as well.
Okay, very nice, very nice.
Yeah. Uh, yes,
Fluid
and then
replacement,
support. Hmm?
fluid replacement, dehydration to
Yes,
cover
yes,
dehydration.
yes, and correct all electrolytes imbalance if any. And
And
afterwards, I will treat the underlying cause according to the result of the investigations.
okay, okay. So I told you that in biopsy you can see periodic acid shift. So what diagnosis can you
The cases shifts.
any
Mm-hmm.
any long-term problem?
Hello?
Whipple's
Mm-hmm.
disease. Can you think about that? Whipple's disease.
Weber's disease, yes. It
Yes.
is Weber's. Yeah, 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 yeah.
Whipple's
Oh,
disease. Some neurological problem, some cardiac
gastro and
problem,
cardio.
lymph
Mm-hmm.
node, joint problem, malabsorption. So
Mm-hmm. Yeah,
treatment will be antibiotics, IV
antibiotic.
penicillin,
Yes,
then
for a long time.
oral Cotri for 1 year. Your history was very good.
Mm.
Your differential was good. Okay. IBD we can put because there is a malabsorption TB.
Malabsorptive
It's also
diarrhea.
very good.
Yeah.
Lymphoma. And at the top, you can put the Whipple disease because I have cardiac problem. I have neurological problem. I
Yes.
know it's a very, very difficult case. I know. I know, very, very difficult case.
I
But
missed
you
the
did very
case.
well.
I
I
missed
know.
the case. Okay, I missed the case. Mm-hmm.
No, no, no. You did not miss the case. Although your approach was good. Your
Mm-hmm.
approach was fine. You discovered, you took history very nice. But
Mm-hmm.
you see, if you cannot read the diagnosis, it's not mean that uh, you lost your
Mm-hmm.
case. I have heard from many mentors that a candidate cannot read the diagnosis, but on the basis of differential, he got
Mm-hmm.
28 out of 28.
Oh.
So
Mm-hmm.
I know this case was a little bit difficult
Mm-hmm.
because nothing was in your mind. Cardiac, how will you explain cardiac problem, neurological problem,
Mm-hmm.
ataxia, double vision. So
Mm-hmm.
it's a brainstorming. Maybe it come in the exam, and it is seronegative arthritis. Seronegative arthritis.
Yeah, yeah, yeah.
Yes.
Mm.
Okay, thank you. No, Dr. Basam.
Yeah,
You
thank you,
can.
Dr. Azhar. But I want to ask about the travel. She asked you about the travel, but
Now,
you said no travel history.
yeah, I asked about travel and I asked about the eyes, any redness, soreness. You mentioned the double vision at the very end.
No, no, particularly the travel. Is it
Mm.
positive, Dr. Azhar here? Or I
He
think it
mentioned
need to
he
be
mentioned
positive, right?
no.
خلاص يلا رحت
He mentioned
Sorry?
no travel.
قهوتك
No,
اصلي جنبك
no,
هنا
no.
انت
I
مشيت.
said,
Sorry.
I said no travel. I said.
Mm.
Yeah, but supposed to be positive. I guess this Whipple was travel, right?
I'm not
It's one
sure.
of the tropical infection.
Uh-huh.
Yeah, it
Yes, yeah,
is.
you are right. Yeah, yes. I told her no, but yeah,
Mm.
I
Yeah,
was not sure. I was not sure of it.
yeah, I think yeah, it was a clue for the scenario to
Mm-hmm.
be positive for travel. Anyway, uh, I think also she didn't ask about the travel before. She said any travel recently, but you have
Uh,
to ask about travel generally, Dr. Najda.
Okay, okay, okay.
But I guess it will be visible. I guess so. It's one of the tropical disease.
Mm-hmm. Mm-hmm.
Anyway, I guess also your approach for diarrhea, Dr. Najla, was long. You took long time. I
Mm.
think you asked a lot of questions
Mm.
related to the diarrhea. I believe three questions can reach or can let you know the diagnosis. Three questions.
Mm-hmm.
It-
Mm-hmm.
did it awake you from sleep, flushable or no? And the compensation and the way of the diarrhea alternating with constipation. These questions is or are very important. I think
Mm-hmm.
you ask about the flushable. I misunderstand also. You ask twice. Does it contain slime? Then you ask, is it flushable? I don't know what was the clear answer. Is it flushable
I
or
mean, slime is mucus. I mean, by asking
so?
about the slime,
Yeah,
blood or
so mucus, it will
slime.
not be flushable, right?
Mm.
It will not
I
be
think.
flushable. So it's
Oh,
malabsorptive diarrhea.
okay. Okay. Do you
I
mean
think Dr. Bass.
malabsorptive diarrhea? It contains slime. I believe it is slime for infective diarrhea. Is it bacterial
No,
infection
no,
or
no.
no?
Slime means not flushable.
Mucus.
Mucus, so
Ah,
it will not be flushable, right?
I don't know.
Actually, this
First
is
time.
what I thought as well, Dr. Bassem. I
Yeah.
thought slime means infection.
No,
Infection.
no,
Yeah,
no, no,
slime
not
mean
No,
infection.
infection.
Slime mean fat,
it's
fat.
No, no, no.
slime, not fat. Slime is mucus.
Infection, I
Mucus.
think. Yes.
Yeah,
So mucus means slime or slime mean mucus?
I
Mucus.
think,
slime
yeah,
mean
slime, mucus. Yes, in non-jargon way, like slime
Okay,
means
so
mucus. So this is
what
towards
and
infective
what it
diarrhea.
will point to? What it will point to? If I
Infection.
said
infection.
infection.
Not
Mm.
just infection. It can be IBS, irritable
Yes.
bowel syndrome, can come with just mucus.
Irritable will come with food particles, I believe.
Uh, Irritable bowel syndrome. Yeah,
So
sometimes
irritable.
IBS can come with just mucus. Just the patient just pass mucus first, and
Uh-huh.
can call. So in this time, the patient will not work at night. It will be
Yeah,
no
exactly.
night variations of the symptoms. Well, in this case, I think you did very good, very nice. But I think it's a good idea to let us know, or to let the examiner know that if you admit this patient or no. So the
I would
first,
like to admit the patient, yeah.
yeah, if you need to admit the patient,
Mm.
and the second thing that, yeah, you will take the bloods and everything. You need to stabilize the patient because he have diarrhea for a long time.
Yeah, I
Yes.
mentioned yeah, IV fluids and electrolyte correction. If
Okay,
any,
good. Maybe
yeah,
I missed that point. So I
yeah.
just very
Yeah.
important part. Right?
This is the only thing that I did in management of this patient because I
Yeah,
didn't
I think
think that.
also the differential diagnosis will be a lot like celiac disease. I
Yeah.
can't roll out celiac disease. I will do
Yeah.
investigations.
Yeah.
Do
Yeah.
thyroid function test because thyroid function test. This patient he has hypothyroidism can come just with diarrhea, so I can't exclude
Yes.
endocrine problems in this
Yes.
patient.
Yes. You are right.
Uh, lymphadenopathy, yes, it's suggestive of infectious disease. I will never put Whipple's disease in my differentiation, to be honest, but
Yeah, difficult one.
yeah, difficult. And I think this is a case of differential diagnosis more than to reach the
Yes, yeah.
diagnosis. Because
Yeah, you
even
are
the
right. Yeah.
consultant in the hospital, they will not reach the diagnosis in the first instance. So they will not be suspected that you will do that.
Mm-hmm.
Yeah.
But your
Well,
approach is nice.
Thank you very much. Thank you.
okay, let's
Dr.
collect.
Basim,
Yeah.
I the same comment like just Doctora now say. I was fascinated by her approach. Dr. Najla did a very, very, very good thing. She missed few things, but her history was very nice. Yes, long because I felt that maybe I slept, maybe something,
No,
because
no, no.
the
It
history
it
was
is. It was long because I couldn't catch anything. Like,
Yes. Yeah.
yeah, because
no,
when I
you
asked past medical history, he's just like a lot of
yeah.
cardiac issues, and so I feel like, yeah,
Yeah,
it's
Dr. Najla,
interesting case.
you catch the diagnosis from the beginning because it was a malabsorptive diarrhea.
Yes, it is. Yeah.
خلاص
Mm-hmm.
خلاص. It
Mm-hmm.
is a differential diagnosis of malabsorption. You got the diagnosis.
Mm-hmm.
You don't need to get to the diagnosis like the doctor said now.
Mm-hmm.
It is if you watch Dr. Salah approach for diarrhea,
Mm-hmm.
you will find out that he is saying once you got the type of diarrhea, the nature of the diarrhea, that means you got the diagnosis. خلاص, finished.
Okay. Okay.
Yeah, you can just memorize the differential diagnosis of malabsorptive diarrhea, differential diagnosis of infectious diarrhea, differential diagnosis watery diarrhea, and then put them in the end.
Mm-hmm.
And then when you don't know the diagnosis, you don't know it is Whipple, but you know that it's a malabsorptive diarrhea.
Yes.
So you put the differential of malabsorptive diarrhea, admit the patient because he's having extra also neurological condition like this, and then you invite the multidisciplinary team, you say the pharmacological and non-pharmacological treatment, and you will get the full mark, I think, because very good history you took. Okay?
Mm-hmm. Mm-hmm.
Yeah.
Mm-hmm. Thank you very
So
much.
just I will advise you and me also to not to be hesitated once you don't know the name of the condition. Just the differential is enough, I think.
Yes.
And
Yes.
as I heard from other doctors, yeah.
I believe if you mention malabsorptive diarrhea, you will get good mark.
Yeah,
And you can
yeah.
put differential, as we are learning, all of us, that
Mm-hmm.
the differential for malabsorptive diarrhea, you can put three of them. On the top, of course, celiac disease. Then the like this patient, Whipple, pancreatitis. The other
Chronic
causes of
pancreatitis.
malabsorptive,
Yes.
yes,
The
short
bowel.
bowel. Any of these, it might be the case. According to your scenario, it will guide you to the diagnosis. Okay, let's revise the question that I collected. If you have a case of diarrhea, three questions will target or will point you to three conditions. So let's start by awaking you from sleep. If not awaking you from sleep, it's irritable bowel syndrome. If awake you from sleep, it will be either infectious or malabsorptive or whatever. It will not be irritable bowel syndrome. So it will be other type of diarrhea. Okay. Is it easy flushable or not? If flushable and it's easy to flush means it's infectious diarrhea. Okay. It's not malabsorptive diarrhea. Clear? The last question, does it contain blood? If it contains blood, so it will point to irritable bowel syndrome or cancer.
Inflammatory, you mean? Inflammatory
Inflammatory,
bowel syndrome or
yeah, inflammatory bowel syndrome as containing
inflammatory bowel
blood
disease, yeah, containing blood,
or
yes.
cancer, yes.
Or cancer, yeah.
And some infectious type like Campylobacter and
Yeah.
Giardiasis.
Mm-hmm.
So this is the way how to approach, and these three questions can shorten all your time if you want. But the most important thing, as usual, we are checking for the emergency or for the alarming signs of admission in this patient. Either to ask him, how did you compensate, or how do you compensate for that? Do you feel thirsty? Just to know his hydration state. Then, if you feel in your examination, you should do that. Capillary refill, skin turgor, and the mucous membrane dryness, sunken eye, GVP. You have to check all these things. Why? Because on this, you will decide this patient for admission or not. Believe me, they ask you, do you want or would you like to admit this patient or no? Always they ask this question for any condition. And you will be in trouble if you mention or if you forget to ask some questions that guide you to admit the patient or not. So please ask those alarming questions. In this patient, do you feel thirsty? Do you feel your skin dry than usual? And you have to feel his skin turgor apart from the capillary refill and the mucous membrane. This is for only hydration and dehydration. It's not the main examination. The main examination, as Dr. Azhar said, there is joint examination, there is eye examination, there is abdominal examination, plus lymph node examination. Okay? But again, at the end, it's case of malabsorptive diarrhea. The clue, I guess it was for positive travel. This is what I know. I don't know if someone has another information that the patient might get tropical or this Whipple disease without travel. I'm not sure. But what I know from part two, it's related to travel history and infection with this bacterial infection, Troponema Whipple. Troponema Whipple, right? So it's
Yeah,
related
yeah, yeah. It
to,
is no. Yeah, it is troponemia. Yes, you are right.
yeah. And the management, I guess Dr. Azhar mentioned, right? It's for long time penicillin and
IV
or
penicillin,
ceftriaxone.
then
Sorry.
oral cotrimoxazole 1 year.
Yeah, 1 year and the previous
An IV penicillin in the beginning,
penicillin, yes, IV penicillin, then 1 year cotrimoxazole.
10 year cotrimoxazole.
Yeah, exactly.
And
Is it
I sent all
infectious?
the detail in the group about
Yeah,
Whipple
okay.
disease.
Okay, thank you, doctor. But again, the triad of Whipple, lymphadenopathy, diarrhea, malabsorptive diarrhea, lymph nodes, and joint pain. Of course, patient will have fatigue, feeling tired, because this is like systemic infection. So the clue here, travel history plus joint pain plus diarrhea and other neurological manifestation. This is the case, and it's not common present in cases. However, you have to know it. And since you have joint or extra intestinal manifestation, you have to think about it, especially for the long time. Dr. Najla, did you related the diarrhea to the type of food? Any particular type of food?
I asked if any recent changes in diet or
Yeah,
yeah.
please always mention the diet and is it related to the pasta, pizza, and
Yeah.
beer?
Mm-hmm, mm-hmm, mm-hmm.
Specify the diet, okay? Because sometimes they are hiding or not mentioning this. If you said, is it related to certain type of food, she will tell you no. But
Mm,
once you ask about pizza and pasta or beer, she will say, yes, doctor, I noticed that. So you might get the celiac from this question. And you
mm-hmm.
can add this question to the question I mentioned. So is it related to certain type of food? Pizza and pasta. I will add it to be also more helpful. Okay, let's go to the comment. Any Dr. Azhar, you see the case down? You can see.
No, I did not see. It's in the chat box.
Yeah.
I can post it in the WhatsApp group if you want.
No, I
No
already
problem.
posted here.
Okay, good.
Yeah, the 30 years communal dizziness.
Yes, Harrison. He's complaining of dizziness and palpitation for 3 months. Vitals are normal. Dr. Najla, I want to assure you, whatever your performance,
Mm-hmm,
they are judging on your performance and how to approach, how to examine the patient rather than getting the diagnosis. So if you
mm-hmm,
do, as Dr. said, If you do the good examination, good approach, good history taking,
Mm-hmm.
and you give good differential, they might give you a good mark. They might minus only for the differential, but at
Mm-hmm.
the end, the general performance will be good.
Mm-hmm. That's
Okay.
really reassuring. Thank you.
Yeah, don't be panic. Oh, I didn't get the case. At least you know it's malabsorptive diarrhea, and you can give
Yes.
three of the differential.
Yes.
It's infectious diarrhea. You can give three of differential, like HIV, like Clostridium difficile. You have
Mm-hmm.
also to ask about antibiotics if you suspect, but it will be for acute onset, not like this long time. Long
Mm.
time diarrhea, either celiac or irritable bowel syndrome and inflammatory bowel syndrome.
Yeah.
And like this patient as Whipple, chronic pancreatitis is also one of the causes of malabsorptive for long time.
Yes. Yeah.
Okay. So it's a big topic, the diarrhea, and how to approach. Ask these four questions. It will help you. At least you rule out the most important and the most common diarrhea cause in cases. These
Mm.
four questions will point to one of them.
Mm.
Awake you from sleep, is it related to certain type of food, does it flush or containing blood? Any
Mm-hmm.
of this, it can point you to the case and to the diagnosis.
Mm-hmm.
Okay.
Mm-hmm.
Uh, Any question from others, please? Thank you for the comment also, Dr. I guess,
Dr. Najla, you also
yes.
asked about previous surgery because people who did gastric sleeve and this bariatric
Yeah,
surgery, they have malabsorptive diarrhea. And
Yeah.
ask
perfect.
this question very early to take it out of your mind. Do you
Mm-hmm.
have before this 1 year?
Mm.
What about your health status?
Mm-hmm.
Do you have any chronic illness? Do you have any previous surgery? And then go on with your questions.
Mm-hmm.
Perfect.
Yeah, that's really
Yes.
nice.
I
Thank you.
always prefer, as Dr. Salma said, start the analysis of the complaint, constitutional symptoms, past medical history. This past medical history include the medical condition, the surgical. Even here, you can ask about herbal. Some patient taking herbal medicine, and you roam around all this case from the history, surgery, and will not find anything apart from herbal. It will be very difficult case if you got the patient is taking herbal and he's hiding and he's waiting for you to ask about herbal, any herbal remedies. And she might tell you, yes, I'm taking herbal to decrease my weight for last 3 months. You see how many trials you are getting to reach the diagnosis, and finally it's related to herbal. So please add it to your approach, especially those type of diarrhea or reduction of the weight or liver affection or high blood pressure. This is how the herbal can come in phases. High blood pressure like licorice and high blood pressure, and in our case here, diarrhea, herbal might be a cause, or liver affection, jaundice, because of herbal, again, remedies, or the reduction of the weight or loss of weight because of also, again, the herbal. You can add this question to the past medical history and the surgery, procedure, over-counter medication, and medication list before moving to the system review. You can get a lot of finding from this part of history, past medical history. It's very important. I prefer and I advise all of you to start with it before going to the system review. Sometimes the system review will give you, yes, some positive finding, but it will not give you the case. Sometimes it carries some of the hidden points, but not precious like the past medical history. And sometimes the past medical history contain blood pressure, blood sugar. You have to analyze them. When you analyze them, you can get a lot of marks and you can get a lot of finding. And the system review will just have few positive findings, like hematuria, like frothiness in the urine, and the diabetes, of course. But it will not be related too much to the case as well as the past medical history does. Okay. So thank you, everyone. Dr. Aisha also wrote carcinoid. I thought really about carcinoid. She said mitral stenosis, but actually it will be tricuspid incompetence or tricuspid regurg and pulmonary stenosis, not mitral stenosis.
Yes.
Exactly.
And flushing and bronchospasm.
Yeah, bronchospa flushing, yes. But at least you thought about it. And by the way, it will be also watery diarrhea, not as an malabsorptive diarrhea. Okay. You are ready, Dr. Azhar, to start?
Yes, 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 yes.
Yes. Okay, here you go.
Hello,
Hello.
I am Dr. Adar, one of the doctor in the cardiac ward. Are you Mr. Harrison, 30 years old?
Yes, doctor. Yes, I am.
Today I'm here to take detailed history and examination and discuss your health problem. Is that okay with you?
Yes, doctor. Please do.
Okay, Mr. Harrison, can you tell me in detail what brought you here today?
Yes, doctor. Actually, for the last 3 months, I have been suffering from feeling dizzy, and it is getting really worse, doctor.
Okay, for how many months? From
It is
last
for
three
the
months.
last 3 months. Yes.
Okay, can you explain me what exactly do you mean by dizziness?
I feel like I feel like I am seeing black, and sometimes I was about to fall.
Hmm. Do you think that you are spinning around the world or the world is spinning around you?
No, no, it's just like when I had the dizziness, I feel like a blackout, we can say, like I was about to fall. So it's
So
really
it is
stressing,
from
yeah, doctor. Hmm?
it is from the last 3 months.
Yes.
So how many attacks you have during this last 3 months?
It's too many, doctor. Like before, I was having an attack or two over a couple of weeks, but recently, maybe 3 or 4 times a week.
3 or 4 times. How
Mm.
did it start? It suddenly or gradually?
Yes, doctor. Gradually, doctor, but it's really
Okay.
getting worse.
Okay. Can you tell me when you have these events, what were you doing
Uh,
at that
most of
time?
most of the times it's why when I stand from sitting position. I will
When
stand for few minutes and then I will start feeling dizzy.
stand from sitting position, you feel
Yes.
dizzy.
Yes.
And did you notice how it is improved? Anything improved this and how you get relief?
No, doctor, I didn't notice anything in particular. No.
Okay. Okay. Can you tell me, uh, did you lose your consciousness
No, no,
when
no.
these?
No.
You did not lose the consciousness.
Yes.
Okay. And the first time you are having this, or before also you are having this this problem?
It's just the last 3 months, doctor.
And before last 3 months you were totally normal.
Yes, yeah, yeah.
Okay. When you have this attack from sitting to standing position,
Mm-hmm.
then at that time, how you are getting relief from this problem? I mean to
Some
say, you sit down, or you lie down, or what are you doing?
most of the times I will just sit back, and after some time it will goes by itself.
After some time,
It will go. It will
it will
disappear. I will
go.
be fine. Yes, I will be fine afterwards.
Okay. Did you take the blood sugar at that time? At
No,
that
doc.
event?
Not necessary. No.
Okay. Anybody commented you that you are getting paler day by day?
No, doctor.
Any shortness of breath on exertion?
No, doctor.
Any racing and pacing of the heart?
Yes, doctor. Sometimes I feel my heart beats.
At what time? When you stand up from sitting
Yes.
position? Eh?
Sometimes, yeah, I will have it with the dizziness. Yeah.
Okay. But when you are sitting and lying, you don't feel any racing of the heart.
No, no, doctor. No.
Okay. I want to know, do you have any past medical history which you want to tell me?
Yes, doctor. Yes. I am diabetic.
Hmm. Okay, for how long you are having diabetes?
It's really long, long time, doctor. It's more than 10 years now.
10 years. So, are you using any medicine
Yes, I'm using insulin.
and only insulin?
Yes, only insulin.
Are you compliant with your medicine?
Yes, doctor.
Any recent changes
No,
in the day?
no,
No. Okay, beside this, you have any other problem?
no, doctor.
Can I see your medication list?
It's only insulin, doctor. I'm not taking any medications. My doctor advised me to take vitamins, so I'm taking vitamins as well. But other than that, it's
Which vitamins?
I'm taking vitamin B12 supplements.
Vitamin B12. For
Yeah,
what?
yeah. Or B complex
Uh,
supplement. It's just supplements. Yeah.
okay, why your doctor described? Do you have any specific problem, any numbness?
No, 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 no. I don't
Okay,
have any.
are you taking any herbal medication,
No, doctor.
any recreational drugs,
No, doctor.
any family history having the same problem or some other problem,
No, doctor.
any surgical history you want to tell me?
No, doctor.
Do
I
you
don't
have
have
any
any.
do you have any allergy,
No, doctor.
any rash?
No, doctor.
Do you have regular partner?
Yes, doctor.
Any casual relationship?
No, not at all.
Do you have raised body temperature?
No.
No. Any changes in the weight?
No, my weight, I believe it is the same.
Any changes in appetite?
Not really. No.
Any nighttime sweating?
No, doctor.
Any lumps and bumps?
No.
What about your mood?
It's okay, doctor. I'm fine. I'm little worried about what is going on with me, but I am fine.
Any sleep problem?
No, I'm not sleeping well.
Any stress?
Sorry?
Do you have any stress in your life?
Stress. And no, nothing recent. No.
Okay. Do you have any headache?
Not at all.
Any vision problem?
No, doctor.
Any speech problem?
No, doctor.
Any weakness of any part of the body?
No, doctor.
Any difficulty with swallowing?
Swallowing, no. I'm
Any
fine.
uneasiness after taking meal?
Um, no, no, doctor. No, I'm fine. I'm eating well.
You are eating well.
Yes.
Any pain, any tummy swelling, tummy discomfort,
No, not at all.
any problem with the bowel habit,
No, no. I'm fine.
any loose motion, hard motion,
No.
any problem with your waterworks,
No.
any specific preference to your weather,
No.
any joint problem,
No.
any muscle uh, problem, muscle weakness, muscle pain.
No.
Okay, okay. Do you drink alcohol?
Occasionally.
And do you smoke?
No.
And what is your job?
I work as a teacher, doctor.
Any history of and how it is affecting your job?
It's really affecting me, doctor. I feel like I'm worried all the time that I might fall, and
Mhm.
I'm really worried that I might have this while I'm teaching. So
Okay,
yeah.
I'm sorry for that. Okay, we will try to solve your problem.
Thank
Do
you,
you
doctor.
drive
Yes.
your car or some big?
Yeah, yeah, yeah.
Uh,
I'm just driving to and out from work.
okay, Mr. Harrison, it's my advice. Please, you will stop the driving unless we solve your problem. You will
Okay.
get to the bottom of your disease. Is that okay with you?
Yes, doctor. It's okay. No worries.
Any recent any history of travel?
No.
Okay, may I examine you?
Yes, doctor. Go ahead.
I, I will start from the hand. Any clubbing,
No. Normal.
any any pallor, any pulmonary edema,
No, doctor. No. It's
any
normal
sweating,
times.
nothing.
No. No.
Pulse,
Pulse normal. 80 per minute. Regular.
80 per minute.
Mm-hmm.
Okay. Uh, I want to check your blood pressure lying and sitting.
Uh, it's 120 over 80 and no drop.
120 over 80.
Yes.
Okay. Okay. Your pulse is 80.
Yes.
Okay. If you stand up from your sitting position, do you feel that your heart is racing more than normal?
Uh, Sometimes, yeah. Yes, yeah, I
Sometimes.
feel, yes.
Okay. Okay. I will check the proximal myopathy.
Uh, hand, upper limbs, you mean? It's normal?
It's normal. Okay. I will check the eyes, pallor, jaundice.
No, it's normal.
I will check the mouth, any ulcers, anything
No,
else.
no, it's normal.
Okay. I will check the chest.
Mm-hmm.
Anything, any problem in the chest?
Normal, clear.
Any, I just want to ask you about any cough, any shortness of breath, nothing.
No, doctor, no, I'm fine.
I want to auscultate the heart, any
Mm-hmm.
murmur, any added sounds.
No murmur, no other sounds.
Yeah, I will check the tummy, superficial and deep.
It's normal examination, soft, non-tender, no organomegaly.
Okay. Do you have any leg swelling?
No.
Sorry, I want to ask you. Do you have any problem with your intimation relationship?
Um, no, doctor.
No problem. Do you have leg pain?
No, doctor.
Do you have regular follow with your eye doctor and kidney doctor?
Yes, yes.
I want to check the fundoscopy. I want to do the fundoscopy because of you have long-standing diabetes.
No need.
No need. Okay, Mr. Harrison, what is your concern?
Doctor, I'm just worried what is going on with me and is it related to my diabetes?
Uh, uh, After taking your history and examination, there may be a possibility, but I'm thinking that we have a one disease which we are called POTS, paroxysmal exertional tachycardic syndrome.
Mm-hmm.
I'm thinking about this, but to confirm my diagnosis, I will involve group of doctors, I will gland doctor, I will involve the heart doctor, and then I want to run some test, and I want to do some scans, and when I am having these results, I will be discussing with you. So there is a possibility that your diabetes may be causing this problem, but I could not find anything uh, which which forced me about your diabetes because it is well controlled and you don't have any problem like
2 minutes left.
early fullness, any problem with your bowel habits, any
Mm-hmm.
problem with your neurological problem, numbness, tingling problem. So most probably, I'm thinking that you have a condition which we call our language. It's a post disease.
Mm-hmm. 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 Is it
So do you
serious,
have?
doctor? Mm-hmm.
So if I don't think so, it's a serious, uh, but uh, uh, but we have to treat it, and I will advise you to some lifestyle changes. Then
Mm-hmm.
we will. Do you have any other problem also?
No, doctor, no, I'm fine.
Okay.
Thank you.
Uh, do you have any other concern?
No, doctor. Thank you.
Still 1 more minute. You want to examine, you want to take history, you want to advise.
Just I will advise you when you stand up from your sitting position. What you will do, you will stand up slowly,
Perfect.
and you will try to take sport when you stand up from your sitting position. And I also want to also want to involve your gland doctor because this may be and he may check your blood sugar. Maybe he can revise your insulin level maybe
Mhm.
you are your insulin is making a problem. You are going in hypo, maybe.
Mhm. Mhm. Mhm.
But you told me that at that time when you are having this problem, the blood sugar was not checked. So there is a possibility it may be due to your blood sugar. It may be due to your insulin. Maybe you
Okay,
are having low blood sugar because of your insulin, and your insulin may be adjusted.
okay, time is up.
Okay.
Thank you, Dr. Azar. Let's go to the exam question. Dr. Najla, you can start.
Yeah. So present your case.
I have a Mr. Harrison, 30 years old. He is presenting with dizziness and palpitation. So beside this, I could not find anything positive in the history. And he's also having palpitation, and he's having dizziness when he stands up from sitting to standing position. So on the basis of this, and he's also diabetic from last 10 years. He's compliant with his medicine and taking insulin. So I have few probabilities. Number one, patient may be having hypoglycemia because of this insulin. Other is there may be post disease.
Mhm.
So to get to the bottom of your problem, I have to run some tests.
Mhm. Mhm. Okay. So what investigation you would like to do?
I will do the complete blood examination, CBC, ESRC, reactive proteins, and baseline. You will say LFT, RFT, your fasting blood sugar, and HbA1c. And I will also do your ECG, echo, and tilt table test.
Mhm.
And I will also go for the ambulatory blood pressure monitoring and heart rate monitoring. And I
Mhm.
also want to do your metabolic profile like calcium and sodium level.
Mhm. 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 So, doctor, what is your differential diagnosis in this case?
Most probably, I am thinking about two. If the heart rate increases more than 30 after standing, so it may be a POTS. And
Mhm.
I also have to rule out maybe the hypo due because of insulin. But as you told that you are taking insulin from last 10 years, no changes in your dose and no addition,
Mhm.
and
Mhm.
you are completely compliant. So my second is it may be hypo due to your insulin.
Okay, hypoglycemia. Okay. Okay? Did you ask the patient the is those dizziness related to his insulin dose or time of meal or
Sorry, I did
yeah.
not ask this.
You didn't ask about this, yeah. Okay, what is your second differential?
Second difference, it may be POTS.
Okay, you put POTS as the first one and hypoglycemia second. Do you have any
No,
other differential?
it may be vasovagal. It may be vasovagal,
Yes, yes, might be this
vasovagal
way.
and reflex. It may
Mm-hmm.
be
Yes,
reflex in kidney. Then I also want to rule out my cardiac. It may be some cardiac problem like long
yes,
QT, Hookham, and
yes,
Brugada syndrome.
yes.
And I want to
Okay.
rule out also this. That's why I'm doing ECG and echo.
Yes, that's good. And you mentioned bots as a differential diagnosis. Is there any specific investigation to confirm bots?
Sports, I will do the tilt table test. And
Mm-hmm.
if the heart rate increases more than 30 within 10 minutes of standing,
Mm-hmm.
then it is a confirmative diagnosis of the POTS.
Okay, okay, that's good. Thank you. And how you will treat bots?
Treat both. I will if there is diabetes, full diabetic checkup, and I will involve the diabetologist and cardiologist, and a full revision of his insulin level and blood sugar level, HbA1c and fasting blood sugar level,
Mm-hmm.
and then the relation of the insulin with the food or the missing food. And then I will also for this supports, I will advise a patient take enough fluids like 3 liters and salt, avoid prolonged standing, and avoid from the caffeine, and
Yes.
to decrease heart rate. I will advise a patient he will take beta blockers. If still no relief, then we can give the midodrine. Midodrine, it will narrow the blood vessels and
Yes, that's
uh,
good.
solve the problem. And then, in spite of this, if patient still not relieved, then fludrocortisone can be given.
Yes, okay, okay. Okay, thank you very much. Are you aware of any syndrome associated with spots?
Syndrome associated with POTS.
Mm-hmm,
No, I think I do not aware of.
mm-hmm, mm-hmm, mm-hmm. Okay, okay. Yeah, it's okay. Still, there's time, or we are done.
Finish, time finish.
Yeah, okay. So for the
Yeah,
syndrome,
time is
yeah,
up.
yes, time's up. So yeah, you did great, Dr. Azhar. Mashallah, you did very well. But for the diabetes, when I mentioned I have diabetes, I just you ask about the medicine and compliance. You need to ask about follow up and what is your last 3 months reading.
Yes, I
Diabetes
did not.
follow up.
Yes,
Yes,
yes.
and because I came with dizziness and palpitation while I having this dizziness, it's better to ask: Is this? Did you like? Do you think it is related to food, related to the dose of your insulin? Are you eating? Because in the assessment of diabetes, we need to assess the diet as well, the diet of the patient. Um, so it's worth asking if it is related to the insulin dose, related to feeling hungry before. You asked me if you need to take sugar uh, to get uh, to get better after the dizziness, but it's worth asking.
What
Do
I
you
ask
feel
you?
hungry before? Yeah.
But I asked you at the time of the events, did anybody check your blood sugar?
Yeah.
You told me
No.
no, no.
Yes.
So
Yes.
that's why I didn't ask.
Yes. Yeah. Yes. It's just this point. What else? Um. In the examination, you ask for sitting and standing blood pressure. You can add and pulse rate as well because it
Yes,
will
I
give
asked you.
you
I asked you, and you told me 80 per minute.
the yes the on the start, but you ask for sitting and standing blood pressure.
Yes, yes.
Yeah, you can ask with and heart rate as well
Yeah.
while standing.
Yes, yes.
Mm. You got my point?
Yeah, yes.
Yeah,
To
but
to roll out reports.
yeah, it will give you the diagnosis straight away. It will give you the diagnosis like the heart rate will increase while standing, but the blood pressure will not drop. Okay, but you did great. You did great, mashallah. You did great. The examination was very nice. Even fundoscopy, you didn't miss. And regarding diabetes, you can just offer a sensation examination for the sensation, like to rule out there is no symptoms of diabetic neuropathy, but or autonomic neuropathy related to diabetes, but it works like offering sensations in the lower limb. Other
In,
than that, I don't have any comment. You did great.
yes, I asked autonomic neuropathy. I asked numbness,
Symptoms, all the
regression.
symptoms you ask about all the symptoms. Yes, yeah. I
Yeah,
mean in
yeah,
the
yeah.
examination.
So
But it's
it
one
was a
of the
case of
definition.
POTS.
Mm?
It was a case of POTS.
Yes, it is both. Yeah,
Yes, yes.
it is both. You got the case from the you got the
Perfect,
case.
Dr.
Yeah,
Azza. Yes,
really
perfect.
perfect. Yeah. And for the condition, it is known to be associated with Ehlers-Danlos syndrome. And
That is
some Ehlers-Danlos syndrome
EDS.
associated with both. Hmm?
And, no, EDS, Ehlers-Danlos
Yes,
syndrome. Thank you.
Ehlers-Danlos syndrome. Yes, Ehlers-Danlos syndrome, and some autoimmune diseases like SLE and Hashimoto's thyroiditis also associated with both. Some patients with migraine also came with spots and fatigue and fibromyalgia syndrome. برضو. Chronic fatigue and fibromyalgia syndromes also associated with spots. Um, yeah, that's all what I wanted to say.
Any mechanism, Dr. Najla,
It's just
related?
not known. No, not known why it
Yeah,
is. It's
just
just association.
association.
Just association. Yeah, just
Okay.
association. Mm.
Yes. Well, thank you, Dr. Najla. Nice case.
Mm-hmm.
And also, Dr. Azhar did perfect.
Perfect. Perfect.
Yes,
MashaAllah.
yes, exactly. Yes.
Mm-hmm.
But I think the differential here also, as Dr. Azhar said, the hypoglycemia and autonomic neuropathy still both can be.
Yeah. Yeah, so differential both and then autonomic neuropathy due to diabetes, and you can put vasovagal or the rest of, or
Addison
hypoglycemia
also.
as
So
mentioned.
yes, I
Mhm.
like some comments related to Addison. Yes, you can put Addison,
You can put
but you
Addison.
have to have the signs of Addison, like diarrhea, tummy pain, and
And
the
no rash,
diabetes. Exactly,
no
hyperpigmentation,
no
hypopigmentation.
pigmentation.
Yeah, and the diabetic will be very easy to control. If the patient is Addison, the diabetic, he will notice that the insulin dose getting lower than usual because of the hypoglycemia associated. So sometimes he can either reduce the dose or he can skip the dose because of hypoglycemia. But I prefer Dr. Azhar to ask about the hypoglycemia, not only Dr. Azhar, all of us. Any case of diabetes, I have to ask about the whole complication of diabetes. Always we are remembering the hyperglycemia, like retinopathy, nephropathy, and neuropathy. But always we miss the hypoglycemia. Did you ever have attacks of hypoglycemia? Why I ask this question for hypoglycemia? Dr. Azhar, what do you think the importance of hypoglycemia in
Yes,
diabetic
patient,
patient?
patient may be patient may be having dizziness because of this hypoglycemia.
Exactly. So either to be related directly to the cause or to the complaint or another thing for the welfare, the driving. It's very
Yeah, yes.
important to know about.
I also in the discussion said, please stop the driving unless we do not reach the bottom of your problem. You are having attacks of
Exactly.
dizziness.
Yeah, apart from dizziness. If you have any disease, any complaint, not dizziness, okay? Like for example, neuropathy or nephropathy, and you have one attacks of hypoglycemia. You have to remember the driving in this point particularly. This is my point. It's dizziness. Of course, you have to advise him not to drive. But if you have patient with complaint apart from dizziness, different than dizziness, and while you're screening for diabetic complication, and you ask him, did you have any hypos or hypoglycemic attack recently, and particularly the unawareness, hypoglycemia unawareness, you should stop his driving. It will be one of the most important points for the welfare. You got my point, Dr. Azza. So, I mean, you have
Yes,
to
yes,
ask
yes.
about hypoglycemia. Put it in your scheme whenever you are screening for diabetes. It's not only the hyperglycemia. Always we are remembering the hyper, but most of us forgetting the hypos. So add it always to your points or your scheme whenever you ask about diabetic complication, okay? Especially those patients with type 1. I preferred if you ask about diabetes the past medical history from the start, it will help you to analyze the diabetes well. How? If you got the past medical history of diabetes type 1, you will ask a lot of questions, including what medication you are on. So insulin. Did you add any dose? Did you increase the dose recently? It will be either a clue or you will roll out it's not related to insulin, as Dr. Najla said. What else you have to screen for diabetes in type 1 particularly? The intake, diet, I mean, the injection site, you have to ask also. Imagine if you didn't ask past medical history in such scenario, Dr. Azhar. You will miss a lot of points, right?
Mm, yes,
So I prefer always to ask about past medical, even young patients. See, he's 30s only, but type 1 diabetes will give you a lot of effort to do. You have to screen for the diabetes itself, the complication of diabetes, the diet, the exercise, the insulin, the rotation of the insulin, using the needles, the mechanism, everything. If it's related to the diabetes as a complaint, you will be in trouble if you didn't start with the past medical history. Imagine
yes, yes.
you started by system review. You ask about all these systems, but still you don't know
if he's diabetic. Sometimes you can miss the diabetes by system review, unless you ask about you feel any polydipsia or thirsty, I mean, and you are going frequented. If you start by system review, I mean, you will just know this patient is diabetic only from two questions. If you remember these two questions, some doctors or candidate forget to ask about do you feel thirsty. That's why I prefer to start with past medical history. And you did it, but I think you took some question before reaching the past medical history.
Yes.
Anyway, and yeah, in general, you did great. I think you didn't miss anything here. Even the intimacy you remember, which is perfect also in this scenario. The driving, the vision, the ventoscopy. I guess you did perfect, Dr. Azhar. I think no more comment from my side. Anyone has comment, please, he can add. Anyone want to comment, please? I will read the comments until someone will open his mic. In this case, should we
Yes.
examine this? Yeah, go ahead. Go ahead.
Sorry, Dr. Bassem, you can continue. It's okay.
Sure, sure. No. I'm reading the comments. Just please
Yeah.
give
Dr.
us.
Bassem,
Okay.
Mhm.
actually, Dr. Najla mentioned if you offer measuring the pulse when you are offering the orthostatic blood pressure.
Yeah.
Just now, I tried to read in up to date about this. This is actually the golden
Yes.
diagnostic.
Yes.
Yeah,
Yes.
Good
the
idea.
Exactly.
golden diagnostic test for POTS syndrome. Because in normal population, if you measure the pulse when the patient, when the people stand
لا لا لا.
from the sitting position,
It will
uh,
increase also,
it will increase also, but for 10
but
seconds
not
only.
significant. Yeah.
Yeah,
Yeah.
but
Exactly.
in POTS syndrome, it is continue to increase without decreasing at all. With the second thing, continue to increase number one. The second thing, with normal variation of the blood pressure, no variation in the blood pressure. So these two components, the diagnostic thing. Firstly, the pulse is increased. Secondly, the blood pressure is not. There is no variation. So
Yes.
in the absence of orthostatic blood pressure
Hypotension.
variation, yeah,
Yes.
hypertension. Yes.
This is the difference also between butcher hypotension
Mm.
and the POTS and
Upwards.
vasovagal. Vasovagal, what will happen in the vasovagal? Brady and hypotension.
Yes.
Yes, yes,
Don't
yes.
So
forget.
Brady,
these
yes.
are the
Yeah,
three
exactly.
differential, and there is comparison between all of these
Mm.
conditions. Vasovagal, hypotension, bradycardia, POTS, normal tension with tachycardia,
Yes.
and butcher hypotension, hypotension with or
What's that?
without tachycardia.
Yes.
My comment to
Yes,
Dr. Azhar,
exactly. Yeah.
Dr. Azhar, hemoglobin A1C inquiry is very important.
Yes, agreed.
What is your
Agreed.
last hemoglobin A1C or the reading test for the last 3 months? Because if it is high, you are going with autonomic neuropathy. If it is low, you are going with Addison. And
Exactly.
also, the second comment, when you are asking about any skin rash, the patient will tell you no. But if you ask any skin changes, like changes in the color of the skin, the patient in Addison will tell you yes, my skin became darker. But if you ask about skin rash, he will tell you no. This is what I heard from the mentors.
You are right.
Yeah,
You are right.
perfect, Dr. Salma. You're right. So add to my advice earlier. Whenever you screen for the complication of diabetes and the hypoglycemia, also ask about particularly how much the last hemoglobin A1C, which is called 3 months reading for blood sugar. You have to ask why. It will give you a clue if this patient is poorly controlled or is tightly controlled or is he well controlled. And according to each reading, you will know is it related to the case or not. So hypos or tight controlled, you will think about hypoglycemia and Addison as well. But if hyper, like 7.5 and above, you will think about autonomic neuropathy. If well controlled, you can think about something else outside this reason, like diet or exercise or whatever, or POTS or whatever the case is. Okay, always ask this question. It's very important. Thank you, Dr. Selma, for adding
Yeah.
this point.
Yeah, I just wanted to add something regarding the treatment.
Yeah,
Dr. Ashar, he did very well regarding the advice, lifestyle changes.
exactly.
We can advise increase salt and fluid intake as well because dehydration might make it worse. Compression stockings can be offered as well, and
Yes.
position change you mentioned, slow position change,
Gradually.
yeah, gradual
Yes.
position change, and small frequent meals. And you mentioned no caffeine, but we need to mention as well no alcohol. The patient is taking occasional alcohol. You should advise him to stop taking alcohol even occasionally, because it makes the condition worse. Regarding management, if those measures doesn't work for the patient, you can, yeah, you mentioned fludrocortisone, midodrine, SSRIs as well can help. SSRIs can
Perfect.
help with in bots, yeah, in controlling the yeah, the
Perfect, Dr.
symptoms of
Selma.
bots. Okay, yeah, this regarding management. Oh,
Thank you, Dr.
yeah.
Najla. I
Mm-hmm.
want to advise you in your case, Dr. Najla, about the diarrhea. I forget this point. It's very important in the history. You ask about any family history of same condition. I prefer to add any family history of cancer colon, especially if you have loss of weight, loss of appetite, and lumps or bumps. You have to rule out cancer
Yes.
colon,
Mm-hmm.
particularly from the history. Okay.
Lymphoma.
Uh,
Lymphoma we have.
And lymphoma as well, yeah.
yeah, any family history you want to add a question, it will be related to the case. You have to specify it by name. Don't say any family history. Yeah, it will be negative. If you ask particularly for cancer colon, yeah, doctor, my father had a cancer colon. But if you ask any similar condition, maybe I will say no because no family history of diarrhea. You got it. So try to specify the family history in certain conditions. One of them, diarrhea with alarming signs. You have to ask for family history. If you have any family history of cancer colon, you can apply Amsterdam criteria and you might put the cancer colon one of the high likely possibility in your patient. Okay? Any question or added point? Yeah,
Okay,
let's
thank
go.
you.
Yeah, most welcome, Dr. Najla. Well done, and thank you,
Dr.
everyone.
Basim,
Yes, yes,
have
go
you
ahead.
heard ever that bots come in the exam?
Yes, yes,
It
many
came
times.
before.
Many
Yeah,
times.
before, yes,
So
but
let
it's not
us,
recently.
yeah, so let us think
Go
like the
ahead.
candidate in the exam. Uh, how can we reach this diagnosis? The patient is having dizziness and tachycardia, and he is diabetic. So our concentration would be on Addison and autonomic neuropathy. But in the history, there is no positive
No,
data
no. She
towards
will
both.
say, she will say, I have racing of my heartbeats. You can't specify the timing and the position related to this
Mhm,
tachycardia. And Dr. Azhar, always remember to
mhm,
ask what is the pattern of this heartbeat? Is it regular like the clock, regular or irregular, just haphazard beating, or slow? Any patient has palpitation, please, or a feeling of his heartbeat, try to know what is the rhythm. Okay, he will guide you to the case, either brady or sinus tachy or irregular like AF. In this patient, it will be regular. He will tell you, yes, it's regular, doctor, like the clock. Tick, 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 like or you can tap on the table in front of him. But the clock is the most regular one. Tick, 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 tick. Okay. So it's easy to mention, is it regular like clock? And you can get the answer. Yes, he will say yes. So this is regarding this point, Dr. Salma. I will know from this awareness of heartbeat. It's one of the questions in the system review, right?
Um,
I said these two
yes.
questions, chest pain or awareness of heartbeat. She will or he will tell you, yes, I
Mm,
had awareness of heartbeat. So you will analyze it. When exactly, what is it? Is it regular? Is it irregular? Is it fast? Is it slow? Is it
Mhm.
related to position? He will tell you, yes, doctor, I notice it's more when I stand from sitting. So
Yeah,
it's
Yeah.
yeah,
target question. Yes.
yeah. It is, but it can come with the with hypoglycemia as well. I got is that right, Dr. Basim?
Yes, yes, it happened with
Yeah, it
hypoglycemia.
happened with
Yes.
hypoglycemia. So,
But he
Doctor,
will ask about other things. It's not
yes,
only tachycardia, it will be sweating,
yes.
hunger, pain.
Mm-hmm.
This is the difference between both.
I mean, still, in such situation,
Yeah,
maybe it will not come in our mind because of
yeah,
the exam stress.
yeah,
So let us just agree together, all of us, to put it in the
yeah. I,
differential
I got,
regardless.
I got your
Yeah,
point. I got your
yeah,
question,
yeah,
Miss Dr. Selma. So,
yes,
for both, I believe we can work it out by excluding others. Like, because what can cause postural dizziness? It's either um when I did this case, I thought about Parkinson, but the patient was young, and I asked about any abnormal movement, any shakiness. There is nothing. And
okay.
then you can exclude anemia as well. You can exclude Addison. It's easy to exclude Addison by the symptoms, like or when in examination, no discoloration, and the postural, when you do the postural sitting and standing, blood pressure, it will not drop. And the autonomic neuropathy, by asking the questions like what Dr. Ashar did, it very perfect, like even the intimate relation, and all the questions about the autonomic neuropathy of
Gastroparesis,
diabetes.
like this.
Yes,
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 yes.
early fullness, and all these things. And then you can exclude drugs. Also can cause postural dizziness. So this patient is not taking any diuretics, not taking AC inhibitors, not taking nitrates, not taking any alpha blockers, not taking any medicines that can cause postural symptoms, postural dizziness. Other than that, vasovagal you can exclude it by what you were doing while you having this, like hot weather, dehydration, such things.
Yeah, and the
Yeah.
frequency.
So yeah,
So,
so your history should be like
mhm,
like to exclude all these symptoms, all
yeah,
these conditions,
mm,
and put it in mind, like the blood pressure is not will not drop in this case. So you will think about the heart rate. You need to ask about the heart rate while sitting and standing, heart rate with the blood pressure. We can make it a habit, like asking about sitting and standing, blood pressure and heart rate. So just to remember it.
yeah. So really, really, thank you, Dr. Najla and Dr. Azhar. Really, really, thank you.
Yeah,
Because if I didn't, I am not here today. Maybe I will not think
Yeah,
like this.
yeah, yeah, yeah.
Yeah,
Whenever
this
it's
thank
is
you,
important to
Dr.
thank you
think.
so much.
Dr. Selma.
Thank you.
You took
Hmm.
what I want to say. I
Yes,
want to reassure
yes,
you that once you attend this session and you know about postural orthostatic tachycardia syndrome, so you will never forget it again. This is the lesson from today's session. Why? Because now you know about it. For me, I didn't know about it except when I heard it. Then I practice it once, and after that, always in my. So what I want to say that if you attend the session today, you will know this differential, and you will know it if it comes in the exam or in any scenario, in any participation with any other session. But again, if you want to make it more fixed, try to practice it with someone as a candidate, sorry, as a surrogate. Give him the case and do it as a surrogate. And after that, you will never forget it. But I can reassure you that after you heard about it today, you will never forget it again. Hopefully, inshallah. Okay.
Dr.
And
Basim.
as you
Yes.
mentioned, Dr. Selma, it is all about the history taking techniques of examination and differential.
yes, of course.
Yeah.
Yes,
But
Yeah.
don't give it as a differential in less common position. So don't give as differential in, for example, for a patient with autonomic neuropathy. It's related only to partial hypotension and vasovagal, and as I said, this case. So you can give it whenever you have patient with tachycardia with standing from sitting. You got the last advice.
Yes,
I mean,
yes, I
don't
did.
say it in the autonomic neuropathy. You will say, I have to think about POTS because it's not common to give as a differential. If you want to give dizziness with autonomic neuropathy case as a case, you can give the medication, you can give hypoglycemia, you can say autonomic neuropathy, but don't say POTS. He will tell you why POTS. Unless you have tachycardia in the history, so you can say POTS, I can think about POTS because it's not something common to give as a differential. But you have to know it might be a case and it will be as we presented today.
Dr. Basam, in
Yes.
autonomic neuropathy, there may be tachycardia.
It will be tachybrady. It's not something fixed. Why? Because it's autonomic neuropathy means there is disturbance in the autonomic system. So it might be either tachy or brady.
And the
Okay.
most important, what we mentioned, that in order to diagnose POTS, you have to have normal variation of the blood pressure. You have to have only pulse variation. The pulse
Tachycardia.
is
Yes,
increased.
exactly.
Yeah, when it's standing, the blood pressure will not. This is the
Exactly.
golden
Yes.
diagnostic test.
Dr.
By the
Basam,
way,
I'm just I'm just repeating. Just you will correct me. In ports, heart rate will increase, BP will be normal, and then in postural hypotension, BP
normal.
will be
Yes.
low. Now
Yes.
heart rate will be normal. Heart rate will be normal. In
Yes.
post in vasovagal, BP normal, heart rate will be low.
No, no.
Now,
All of them low.
in
Vasovagal
vasovagal,
low
blood
and
pressure
low.
also low. Blood pressure also
Yes.
low. Vasovagal. Okay.
Yes.
Okay. I'm
Okay.
writing. I'm writing.
Yeah.
Uh,
Yes. I want to add one point more. You know how they are diagnosing POTS and postural hypotension with sorry, POTS and vasovagal. POTS and vasovagal. They are using the same.
Table test. Table test,
Perfect. They
right?
are using exactly,
yes.
yes.
Tilt table
Tilt-table
test.
test. Exactly.
Yes.
So they will see with the positioning of the patient, turning the patient, the blood pressure will reduce or the heart rate will be increased with the stable blood pressure. This is the differences. Again, this is the difference between POTS and vasovagal. The vasovagal, brady, hypo, and in the both postural orthostatic tachycardia, the heart rate will increase without changing the blood pressure. Okay,
I will
And
nice
try to
topic.
take a
Yeah,
screenshot, Dr. Azhar, from up to date and post in the group, inshallah, just now.
yeah, okay, okay. Thank you, Dr. Salma. Thank you so much. Any comment
okay.
else? I will read the comment. In mouth, bedside ulcer. Beside ulcer, we should comment on candidial infection. You can open the mouth while examining the patient like you are looking inside. Just act like you are checking for. But I think you will never remember about candidate unless the patient is having difficulty of swallowing. But you can just act like you are checking the mouth from inside and the teeth. As I said yesterday, you also let him open the mouth widely. Show me your teeth to check for his dental caries. In this case, should we examine the pulse for 1 minute in sleeping and standing position? Yes, in sitting and standing. The same as you are offering. Please, can I know the blood pressure sitting and standing? You will say, I want to know the heart rate sitting and standing. Of course, whenever you suspect it, not usually asking about the heart rate from standing to sitting or from
In the
sitting to
exam,
standing.
we
Yes,
have to check the pulse.
no, the blood
By
pressure.
no, no, pulse. We will
Usually,
count the pulse.
count the pulse on sitting. You will not say, "Can I check the pulse while standing after sitting?"
No, no,
You got
no,
my
no. In routine. We will count the
routine.
pulse in every exam.
You can count for 15 seconds and you can say it's regular or irregular. But the number,
I think for I think
I,
in
I,
long
I
case
didn't count really.
in long case scenarios, I believe they will provide the vitals. I don't think we should do it
Yeah,
by
exactly.
we should
And
ask
you
for
can
it.
ask,
Yeah.
you will ask for it, and they will say like in the paper, they will say like that. So no need to count. You don't have time to count 15 and you will multiply by 4. No time for this. Believe me. Either to check the regularity, or you can ask, can I know the vitals? They will tell you as outside.
Yeah,
That's it.
and you
Skip.
can you say I want to do blood pressure sitting and standing and heart rate. So I believe, I don't know, but I believe this examiner should provide this information. I
And
don't
in the
know.
Yes,
short case,
they will
and in
answer.
the short case, in short case, we have to measure the pulse.
You
Yes.
can act like you're counting. Yes, and you can say about the regularity and the pulse volume. No one comment about the pulse rate. No one asked me in the 2 times. No one asked me how the pulse rate. They ask me, is it regular or irregular,
Okay.
and the volume pulse or the pulse volume. So you can comment on the volume and on the regularity, not the number. Unless you feel it's very rapid, you will say tachycardia, or very slow, you will say this is like bradycardia. But it will be usually within the normal limit from 60 to 90. Okay. So other comments, please. In this case, should we examine the pulse for 1 minute? Yes. No, you can offer only. No, I mean, should we do it or just say I want to check? Yes. Just say I want to check. No need to do it. Was worried because no time. Exactly. You don't have time to count and to multiply. But and the stress also will not let you do it. So what you can do, comment on the regularity and the pulse volume, plus the water hammer pulse, also of course collapsibility. This is what you can do in all station, either short as a cardiac or as long if you find something related to the pulse. Migraine, chronic. I think we finished the comments. So yeah, someone, yeah, Dr. Hatem wrote about migraine, chronic fatigue, autoimmune. It's association of the previous scenario, right? Or this scenario. POTS? Yeah, POTS syndrome. Yeah, that's one of the association in the POTS. Okay, always remember to ask about hypoglycemia. Yes, this is my comment, as well as the hyperglycemia. Autonomic neuropathy post-COVID, Dr. Sarah. Of course, we have to roll out autonomic neuropathy. Addison, yes, but again, the Addison will be a clue after you find the blood pressure, the blood sugar is well controlled or easy to control, and the insulin dose lower than previous. Plus the autonomic neuropathy signs and symptoms, diarrhea and hypotension, or if you have a change in the intimacy or difficult to have intimacy. Adrenal function, yes. Okay. I think we've finished the comments. Nice session as usual. Thank you, Dr. Azhar and Dr. Najla. Any question, comment before ending the session? Thank you, Dr. Salma, for the interaction today and the comments, the clarification of the topics of POTS. See you tomorrow, inshallah, if no more questions. Okay, we end the session. Thank you for the attendance today. See you tomorrow with the communication day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum assalam wa rahmatullah. Thank you.